I'm Sloan Lawson. Today I would love to speak with you about physician-assisted suicide, or PASS. This is the right for individuals to choose when and how to end their life on their own terms when they have a terminal illness. If you have viewed my other videos, you'll know that this is something I've spent several weeks researching and forming an opinion about. I'm so excited to share my perspectives and insights with you today. In October, my grandmother passed away. She fought against many medical conditions for a long and hard time and had a wonderful life. But by the end of her life, she was neither comfortable nor happy. When she died, my family was sad, but also relieved because she was home and no longer suffering and in pain. Her life would have been vastly improved by being 2 years shorter and not being forced to endure so much suffering. PASS is an important right. It is morally acceptable, and it does not betray doctors' obligations to help their patients. Today, as we discuss, first I plan to tell you why PASS is a necessary right. Second, we will get into why it is ethical, and finally, why it is reasonable for medical professionals to perform this procedure. Let's get started. In modern-day America, there is a much greater need for physician-assisted suicide because the quality of medical care is ever increasing. People's lifespans have gone increasing as time has gone on, and sometimes it's longer than an individual wants to live. The CDC tracked and predicted the average lifespan over the time period of 1960 and predicting to 2060, and it is going to increase to 86 years. This graph in front of you shows the female average lifespan, male, and the combined lifespan. If you'll notice, in only 100 years, it has increased almost 16 years. This is completely incredible, but lifespans often extend much past the point at which people want to live. In addition, increased medical care through increased lifespans means increased medical expenses. Thousands of people spend thousands of dollars on palliative care that will inevitably fail. The average cost of end-of-life care in the last year, out of pocket, is $11,618. This is a statement by the National Bureau of Economic Research, which is a nationwide research facility. Physician-assisted suicide provides a way to ease the financial and emotional burdens brought by the increasing medical care for both the palliative patient and their families. PASS is not only needed, but it is also morally acceptable. A very common argument as to why PASS should not be legal is that it is morally reprehensible. But I would argue that it is in fact an honorable death. In many cultures, suicide is viewed as a dignified way to die. Jerome Young of the Kennedy Institute of Ethics wrote, "Suicide in Japan is viewed as a potentially honorable, virtuous, and even beautiful act of self-sacrifice, expressing one's duty to one's group. A person seeking physician-assisted suicide is willing to give up their own lives to spare their families the agony of their deaths and the potential financial ramifications that could happen. This peaceful death and lack of suffering for the patient and the family is one of the most compelling reasons to support physician-assisted suicide. My own grandmother died over the course of several years, and it was one of the hardest things anyone in my family has ever had to watch. I ask you to please help to spare this for other people. Allowing physician-assisted suicide is a truly merciful act. In addition to all else, restrictions could help to keep the moral high ground in this argument. I have previously discussed this extensively in other presentations, but every area has their own restrictions that allow physician-assisted suicide. For example, Jay Gion discusses in Oregon how it is required for a patient to have a terminal illness and 6 months left to live. Other restrictions can include types of illnesses, ages at which this can take place, and other regulations. All of these things allow individual counties, states, governments, and countries to decide when they think it is acceptable to choose to die. Between cultural considerations, an increase in peaceful deaths, and the included restrictions, PASS is an admirable piece of legislation to support. Another very common objection is that PASS forces doctors to harm their patients, but in fact, not allowing a dignified death does more harm. Many doctors take the Hippocratic Oath when they graduate from medical school. According to Harvard's health department, the oath promises to do no harm. This essentially means that no matter what happens, the doctor will not do anything that could negatively impact the individual's health. This oath actually increases the importance of physician-assisted suicide. Mental well being, psychological health, and physical well being should all be considered in what is harm. A low quality of life, depression, unhappiness, and physical pain are all aspects of well being. Not allowing a patient's death does more harm than the end to their physical bodies does. In addition, doctors would never be forced to assist with a suicide. Any doctor who felt differently about the morality or legality could refuse to do the procedure and refer to another doctor. This would remove a large aspect of the moral quandaries because it leaves it up to the individual patient, the individual's family, and individual doctors. Every person would be allowed to make their own decisions. Because it is better for the patient, physician assisted suicide does not violate the Hippocratic Oath, but rather encourages all around patient health and well being. As we wrap up, I hope you have considered the importance and morality of physician assisted suicide more. I hope even more that you have come to agree with me that this is a vital and ethical right that should be protected. There are many factors that are considered in this ethical decision. The first being medical technology and the ever-increasing lifespan. This leads to a lower quality of life oftentimes and should be considered. In addition, a peaceful death for those involved, both the family and the individual, and cultural considerations on how we consider death should all be considered. Lastly, allowing physicians to truly help dying patients and their families rather than simply easing the pain is something worth fighting for. As you consider more after you leave today, please keep in mind my grandmother and the thousands like her. There are many people around this country suffering and dying painfully. It is unfair to enforce a life that is no longer joyous. Most of all, please remember, respect, and honor those who are suffering, and no matter what their decision is, be supportive. I ask you to continue to think and debate about this. It is a very important topic, and even to advocate for this legalization in your own states as it comes. Thank you so much for listening. Let me know if you have any questions, and I hope you have a wonderful day. Bye.